Morning at NTV, we are live from Kampala's Serena Conference Center. I'm Andrew Chamagero, and today we're talking about the effects of COVID-19. One of the effects of the COVID-19 lockdown on a daily is that people living with HIV and AIDS, whose livelihoods depend on medical care, have now become a vulnerable group. To speak to us about the experiences of people living with HIV and AIDS, we have Dr. Karusa Kiranga, the country director of the UNAIDS agency, and she'll be joining us via Zoom. And we have Stella Kentusi, an executive director of the National Forum of People Living with HIV Networks in Uganda. Good morning, Dr. Stella.
Karusa Kiranga.
I'm so humbled that you took time to have this conversation with us. For starters, how are the people living with HIV holding up? How is the ground?
Okay. Thank you very much, and thank you for the opportunity to share some of the information we have about people living with HIV. In Uganda, I think people living with HIV have been able to get their drugs because Uganda has a program that allows people to get drugs for 3 months, so that at least one doesn't risk running out. But we know that already people are running out, and that is quite a bit of concern for us because people have been telling us that they're running out. We did a rapid assessment at the beginning of April, and we found that already 75% of people living with HIV that were members of a specific network that we work with, Nafofanu, already had 75% only had 1 month supply.
Oh God.
And that's now almost a month ago. So we're really quite concerned that even though Uganda does have a program to give 3 months supply, of course the COVID arrived wherever you are with your 3 month supply, whether you are on your 2nd month, whether you are already on your 3rd month. So we are really quite concerned, and we're hearing a lot of concerns about people running out of drugs, people asking others to help them get the drugs. So it's
As someone at the top of these networks that help people living with HIV and AIDS, have you tried to reach out to them? How have you helped them to possibly get these drugs on time?
So we as UNAIDS have been working with across the board, both supporting the government of Uganda to increase access, the Ministry of Health, Uganda AIDS Commission, to increase access to services for people living with HIV. We also are working with the networks such as Nafofanu and others to be able to increase services for people living with HIV. We are also providing information and sharing alerts and telling people that there's a challenge here, we need to do something about it, particularly in relation to transport, when people are not able to go to the hospital to get the services, to go to the health facility, when they have to have documentation to prove that they are actually legitimately are supposed to be up and about. So we are trying to provide also information about those kinds of situations.
In the work of providing this information, Stella, what is the public perception? Are they receiving it rightly? Are they positive about it? Are they worried? What is their psychological stand on this? I understand it goes to the entire nation, but this is a vulnerable group here.
Yeah, I think Stella is the lady on the Skype Skype line, and she would have more information on that. But what we are hearing, there's a lot of anxiety, as you can imagine. People living with HIV have been very diligent about taking their medications and reporting on time, and they're really quite informed and quite educated about their disease. They know they've had it for a long time, so they're quite engaged. So when there's a challenge like this, and they've been informed and advised, you cannot miss your medicine. You have to get, then you can imagine the anxiety that comes with not being able to access medicine. But they're very supportive of each other. They work very closely together, and I think this has really helped in terms of them getting access, getting more information, and sharing with each other.
Well, there you have it. Dr. Stella will be joining us a little later. We are having a Dr. Karasu Chirangu on site explaining she works with UNAIDS, and these are partners that are fighting HIV and AIDS from the grassroots to the uppers. I want to understand, Dr. Chirangu, what is UNAIDS doing at the time of the lockdown? I understand your projects are quite expounded on the ground and all that, but to ensure that your work, what you're doing before, was not watered down by this crisis, what is UNAIDS doing on the ground to stay grounded?
Thanks very much for that important question. And I think many partners are working because we know that even though there is COVID, we cannot suspend our other activities.
Absolutely.
We cannot suspend the SDGs, for example. People still need to be able to have access to education. People still need to have socioeconomic development. So we are working together to ensure that those other activities are going on to the extent that they can in the context of the government's directives. UNAIDS, as you may know, is actually a consortium of 11 UN agencies in Uganda that are working towards HIV. And that includes WHO, for example. It includes UNICEF, UNFPA, UN Women, UNESCO. So we've got a consortium that is continuing to do our work. For example, our work in relation to sexual reproductive health, making sure that people can still get access to sexual reproductive health services, can get access, especially to condoms, because we don't want to have a problem with HIV later once we, as we are dealing with COVID. We don't want to have a problem with contraception later as we're dealing with COVID. Working to reduce gender-based violence through organizations such as UN Women. So we've got activities still moving to the extent that they can operate within the guidance that the government has given.
This entire experience, what do you make of it?
It's, as they're calling it, a biblical experience.
Okay.
And I think it really is. They've told us that nobody less than 102 years old has experienced anything of that sort.
True.
Which is basically, I think, probably all of us in Uganda. It is quite, it's changing the world, the way we think about it. It is certainly going to have long-term implications. And I think we have to come together and work together to make sure that we minimize the implications for Uganda, we minimize the negative consequences for Uganda. And that is what we as the United Nations are working towards.
Okay. Last evening, your boss, the Executive Director of the UNAIDS, the Honorable Winnie Byanyima, said on her Twitter, I want to quote, "We need to learn the lessons from the fight against HIV, but I'm worried that I'm not seeing that fast enough." So what lessons are these that we need to learn from the HIV fight if we are to defeat COVID-19?
Well, there's a number of lessons that we've learned from HIV. First of all, the importance of empowering communities and making sure they have information, making sure they have access to services, making sure that they are part and the center of the response. HIV has been very community driven. And in fact, a lot of the progress that we have made, even in Uganda, is because of communities and how communities came together and pushed and fought issues. For example, TASO itself, the AIDS support organization, was established by communities, by Noreen Kaliba and others. And that was really the epitome of how an individual, how communities can come together and say, we have a problem, we need to solve it. So putting people at the center and allowing communities to be at the center of the response is really, really critical. And we learned that from HIV. And we think it applies, obviously, to COVID. It applied to Ebola. It applies to virtually any disease. When communities are empowered, they have their own solutions, and believe me, they are able to come together and solve. That's one lesson. Another lesson that I want to share is the work we've been doing around ending stigma, stopping stigma and discrimination. Because as they've been saying, very few people seem to be among, even though Uganda has, I think, 55 survivors of COVID so far, but you don't see their faces, you see their legs, you see their... And and we feel that by limiting people to come out and these are messengers. These are people who have a message. This is how I survived this. This is what I did. This is how it worked. This is how I felt. We feel that those people are actually very, very powerful messengers. So we need to fight stigma, because in fighting stigma, we can hear from people who have survived. We can learn from how they did it. People living with HIV have always been at the forefront. And by so doing, they share with each other, and they help each other, and they help each other survive. They help each other with coping mechanisms, information, and that we think those are really, really important lessons.
These are important lessons, but what are some of those challenges you've made, even in the line of duty, just to make sure that all this comes to light? Because some of those challenges that are still outstanding, even in the wake of COVID-19, they're just being amplified.
Yes. Well, I think COVID has actually opened a lot of, has exposed a lot of challenges that we, now in Uganda, we are seeing in front of us. one of the biggest challenges is food, as you were talking about. There's so many people who all of a sudden don't have food, and in particular in urban areas, among the urban poor. That is greatly distressing. Just the other day, I think it was you who even showed a very, very compelling program of young people in a church to learn that there's more than 250 of them that have been counting on churches, and now when church is closed, then those young people that used to go there don't have a place to go. So food is a huge problem, and I think the exacerbation of COVID is in relation to issues like poverty as well. The other thing that has come up, obviously, is challenges with transport. And especially for children, because a woman can only carry a child on her back for so long, and the child has to walk, and some of them are small, 6 years old, they cannot walk so far, you know, and they're hard to carry on the back. So the fact that transport has become a challenge has also become a challenge for people living with HIV. And then lastly, as I mentioned, is the medicines. We are starting to hear shortages of medicines, lack of access to medicines, and we're really concerned about that. And then, of course, there's TB. TB is a lung disease. COVID is a lung disease. And the fact that TB and HIV normally exist together is a cause for worry.
Wow. These are very heavy challenges. Joining us for this very conversation, we now have Dr. Stella Kentusi, who is another great doctor there. Doctor, good morning. It's an honor to have you this morning. Good morning, Dr. Stella.
Yeah, this is Stella Kentusi, the Executive Director of NAFOFAN.
Yes. Doctor, tell us, how are you holding up on ground as someone on the ground helping the people living with HIV and AIDS?
We have been able to make a number of calls to our district forums, but we also have some of our groups in and around Kampala, and the people who are open about their status, those whose records are clear in the various health facilities, most of them have been served by the Ministry of Health Public Facilities, but also a number of implementing partners that have been kind enough to even deliver some of these ARVs to their homes. So most of them have been able to access their ART, but ART alone is not enough. This is chronic care. We are having challenges with food. Adherence requires food intake, adequate food intake. So whereas ART could be availed to a large extent, and we are glad the Minister of Health has come on board to provide adequate guidance, including for those who may not necessarily have been receiving ART from the nearby facilities. These at least have been served. But we have challenges of food, we have challenges of treating other opportunistic infections, we have issues around integration. How do they access condoms? How do they access other sexual and reproductive health and rights, services as they need them?
Dr. Stella, have you tried to share? Dr. Stella, have you tried to share these challenges with the government in one way or the other, and has the government reacted to your plea?
Yes, we've shared with the Ministry of Health and a number of implementing partners. And that's why, on one hand, ART access has been a little bit eased, including the home deliveries. Right now, we are sharing the challenge of food. We want to see if the government can come in and treat people living with HIV as a special category, bearing in mind that we don't want to end COVID and then start having more of AIDS-related deaths as a result of people ignoring their ARVs. And then they cannot take anything because they have no food. And then also to protect themselves from co-infections or reinfections. So this has been brought to the attention of the various duty bearers. And we are hoping that just as they tried as much as possible to have an interrupted access to ART, also these other integrative services can also be given out.
From the district level, Dr. Stella, what feedback are you getting with regards to the to the people living with HIV and AIDS with regards to attitude and psychological depression levels?
Yeah, there was, in the beginning, there was a lot of panic, a lot of anxiety, and bearing in mind that people living with HIV had been categorized as high risk because of the lowered immunity. But because of the information that is coming out, I think the levels have gone a little bit down. Our biggest worry is the issue that Dr. Karusa talked about around stockouts. Yeah. There was a worry there is still a worry of stockouts, especially for second line, where some of the health facilities were reporting stockouts. The Ministry of Health and National Medical Stores have pledged and continued support, including the partners, to ensure that these actually get delivered. But the anxiety is still there, although from the feedback, it is not as much as when we had the onset of COVID-19.
And how are you handling the anxiety? What kind of information are you disseminating to these people, and what models are you using?
We still continue to do virtual interactions, and working with our leaders. We have a big WhatsApp group where information comes in, and we also provide feedback. This group has also a number of implementing partners that come and give a lot of information. And maybe to note that most of the panic and the stress stem from a lot of the misinformation, a number of myths and misconceptions that happen. So once this comes in and you have this accurate information, but those who cannot be able to be in that big group are also able to access from their home or community-based radio stations. A number of posters have come out, but we still need to do more. Reaching everybody is not easy. We still need to do more, using every available fora so that every person from the village, from this community level, can actually access this information, to remove these myths, to remove these misconceptions, so that people can be in the lockdown and they are able to know, in case I run out of my ARVs, this is what I can easily access, but also link up with anybody who can deliver these ARVs home. But we want to see more than ARVs. Food is very important.
Absolutely. Hang in there, Dr. Stewart. Dr. Karusa, you realize that she's saying their models they're trying to use, WhatsApp and other technological virtual meetings, if I should say. What do we have in play that we don't leave the layman behind, someone who is not technologically advanced, that they can still access this kind of information, they can still make decisions? What models are in place can we try to explore here?
Communities are still active, communities are still functioning, and information exchange is still happening, even though in limited ways. So for example, in the rural areas, people are still exchanging information. There are challenges, of course, because that is quite now much more limited. But we've been trying to encourage that health facilities are still open, so people can still go there and get information. People can still go there and get services. I think, like Dr. Stella was saying earlier, at first when COVID came, there was a lot of confusion, but things seem to be settling down a little bit now. People now know that you can go and get services. So people still have access to services. People still have access to information. It's not the best way. It's not the way we would like it, because normally we are used to mobilizing people, coming together and discussing these sorts of issues. But now, given where we are, I think people are doing the best through their networks, reaching out to each other, going to health facilities and getting the care and the information they need.
Okay. Dr. Stella, Dr. Stella, if I can just speak this, how are you handling the issue of transportation? Earlier on, Dr. Karusa alluded to the challenge of transport with regards to people living with HIV and AIDS, possibly to come, or the team to send out the drugs to them. How are you handling that from the district forums you subscribe to?
Yeah, thank you so much, Andrew. Just to inform you that a number of our implementing partners have come on board to support some of the network members. Wow. For instance, Beira has been able to provide motorcycles to the network members, to the leaders at the district level. and we encourage them to do to support themselves with the social distancing at the river, but at the same time to be mindful of protecting themselves with masks and all that. And these partners have been kind enough also to have home deliveries for those where the facilities are quite distant. And these other facilities also have been able to accept people living with HIV who are not necessarily getting the ARVs from that area. So our challenge has been those who are not free enough to move to these nearby health facilities. We receive a number of calls. We have a toll-free line, 0800 100 330. And you get someone in Arua, someone in Kaware, and they're asking, I receive my ARVs from Kampala. How do I access the ARVs? I can't go to the nearest health facility because I don't want people to see me. So that remains a huge gap. Stigma still remains a huge gap. Transport has been there fine with a ban on the public and private transportation. But the partners have been able to come in. The Minister of Health has provided a lot of guidance. So our biggest worry is on those ones who still are uncomfortable to get to the facilities that are near to them, or even to have someone have a delivery. To see a Tasso branded car outside one's compound is bad enough for some people. So we are having challenges of those individuals who do not want to be seen accessing services from the nearest health facility, but also even to have a home delivery. And we are hoping that people living with HIV will be able to use every available for us, since there are also these provided opportunities to access the ART, since ART is chronic care and no one should be off. Without a cure, without a vaccine, you cannot take any chance, you can't risk it.
Dr. Karusa, does this allude to stigmatization? Someone in Arua calling and saying that I cannot access my drugs, I don't want to get them from my locality where I'm going to be known, and how do we fight this? It seems to be deep.
It is quite deep, and we've had HIV for close to 40 years now in Uganda, and still stigma is a concern. And that is why we keep fighting and we keep us. So for COVID, let us not have that. For COVID, let us make sure that people can come out, can feel accepted, and do not feel like they're at risk of being abandoned or being, made to feel bad. It's an airborne disease, so it's the issue of disclosure within families is so important. And I know that there are programs to help people disclose to each other. The fears are usually around being abandoned, being shamed, and being made to feel that you did something wrong and that is how you have HIV. And yet many people acquire HIV. A lot of people are surviving HIV who acquired it at birth. For example, a lot of young people living with HIV actually acquired it through mother-to-child transmission before we had medicines for that then. So I think, and some people did not, so it's not to mean that people acquire HIV because they did something wrong. Sometimes it's just the circumstances that they find themselves in. So we try to work towards ending stigma so that families can work together and share with each other in terms of surviving HIV together. But if a husband and a wife, if children, if family members are not able to have that conversation, then you can imagine how difficult it is. And it's even more difficult now in the context of COVID, because you have no one to share with, because you have not disclosed to your partner.
To your partners. Dr. Stella, as we're winding up, what could be your last words to the people living with HIV and AIDS, those watching from around the globe and in Uganda?
Yeah, thank you so much, Andrew. My plea to people living with HIV is to stay calm and acquire as much information as possible to avoid all this misleading information. But at the same time, my appeal is to our various duty bearers. Let us integrate. We can have ARVs fine, but we also need food. People are throwing away ARVs because they cannot take without food, but also include other services that they require. My other plea is to those who are living with HIV but are not yet comfortable to come out. I think this is the time to join the peers so that the psychosocial support that is going on can actually reach them as well.
Thank you so much, Dr. Stead. Dr. Chirango, as we're winding up, what could be your last words to the other supporting partners and with regards to the UNAIDS agenda to the Ugandan living with HIV and AIDS?
Thanks very much for that question. In Uganda, we have 1.4 million people living with HIV. That's a large number. It's a large number because people are surviving. Oh, yeah. But we still have about 50,000 new infections every year. It's about 1,000 a week. So those are significant. So our agenda also has to make sure that we are preventing HIV, just as we are dealing with providing treatment and supporting people with treatment. The UN is very strong in its partnership. We recently had an appeal to address COVID, and we are continuing a global appeal as well as an appeal for Uganda. We do know that because Uganda has been surviving HIV, Uganda has been doing relatively well in the context of, we feel that these lessons from HIV to COVID will also help us survive COVID and be able to deal with it.
Wow. There you have it. These are the two doctors. Thank you so much, ladies, for being part of this conversation, and those who have been watching online and being a part of this conversation. If you're HIV positive, like Dr. Stella said, it's the time to come out. And if you're one person who is in the support structure that needs to empower these people to see them through, well, just like Dr. Akarasu said, you are in the right time to actually support them. This is Morning at 10 TV. We'll take a break and we'll be back shortly.